My name is Dennis Rosen, and I'm a pediatric pulmonologist at Boston Children's Hospital. For me, care means addressing not just the physical component of disease, which is what usually brings the patient into my office, but also the way the patient experiences his or her disease process, how the patient and the family, because I'm a pediatrician after all, understand what is happening to the child, how their beliefs and goals for treatment intersect with the different treatment options which I am able to offer, and how they interact with society as a result of their disease process. And as obvious as this may seem, I fear that over the last several years, with the increased pressure on doctors to become more quote-unquote efficient, that is, to see more patients in less time, to get patients out of the hospital faster, there is a much greater emphasis on cure than there is on care. And of course, without addressing these other aspects of the disease experience, it's very difficult to offer a treatment plan which the patient will embrace and which the patient is more likely to carry out, and with which the patient will be more satisfied. And so this is really something which I fear is a big problem in our current medical system. One example of this which I can provide is the case of a child I saw a couple of years ago who had a number of congenital abnormalities for which he was followed at my hospital, and he had been diagnosed several years earlier with obstructive sleep apnea and had been prescribed CPAP, but was just not able to tolerate the mask while he slept. And so for the next 2 years, he did not use it and went untreated. And then he came back to Boston for additional treatment, and during the course of his stay had been sent for another sleep study to see whether or not the obstructive sleep apnea was still a problem, and it was. And so he was sent to come see me. And so when I walked into the clinic, the family was already there. I could immediately sense the tension, and so the mother spoke up, and after I'd introduced myself, said, "So there's really no choice. We have to go with the CPAP. Is that right? That's what you're going to tell me?" And I opened up the sleep study, and I said, there's something interesting here. When your son lay flat on his back, his obstruction was significant. But when he slept on his left side, he did really well. He did not have any obstruction. And there's a physiological and anatomic basis for this. His tongue was not flopping back, was not blocking his upper airway. And I said to her, I said, I think if we were to ensure that your son slept in the side position, his breathing would be much better. And the mother was thrilled beyond words initially, and she said, "That's great. I'm so happy we don't have to use the CPAP." And then something in her demeanor changed, and it was like a cloud had passed over her. And I asked if something was wrong, and she said, "Doctor, would it be okay if my son sleeps with his right side down instead of his left side down?" And I said, "I think so. We didn't study with his right side down, but I think that would be fine. Why do you ask?" And she said, "Well, doctor, in our tradition, the Muslim tradition, the Prophet has instructed us to sleep with our right side down, with our hand under our cheek. And it would mean so much to me if my son could sleep on his right side instead of his left side." And I told her that seemed fine to me, and she was thrilled. And subsequent to that, the child had a number of other procedures done. We wound up repeating the sleep study later on and doing it with his right side down, and he did very well in that position. Continued to have obstruction with his left side when he was flat on his back, but when he was on his side, did very well. And ultimately, this was a pretty easy fix. I had the mother buy a t-shirt and sew a tennis ball in the pocket, and that was that. But I feel that had we not gotten to the point of discussing how this treatment was seen in her culture and what might make it easier for her to carry it out, I'm not sure that I would have been able to provide the treatment that this child needed. So that's my take on cure and care.